My name is Dr. Wallace Akerley. I'm a medical oncologist at the University of Utah's Huntsman Cancer Institute. I take care of lung cancer specifically. That includes both smoking and non-smoking lung cancer. I'm a professor of medicine and have been at the Huntsman for over 20 years. So within the area of lung cancer, it's overwhelmingly dominated by tobacco. And one of my great interests at the University of Utah has been to look at never smokers' lung cancer, specifically because the state of Utah has the lowest smoking rates in the country. And it's important to look at what's going on in your population. And that comes in two forms. One is radon is the number two cause of lung cancer, so clearly a reason that I would have an interest. So radon's a radioactive gas. It gives off alpha, beta, and gamma decay. And so it's radioactivity. That's the piece that people have to understand. Radon is a radioactive material. And anything that's radioactive can damage our DNA. The gas can collect in a space, and our lungs have never been meant to be exposed to that kind of local radiation concentration. Radon is it's a not there or there thing. It's an entity and it's continuous, meaning that there can be levels of outdoors where there's a lot of dilution. Levels can be typically on average zero point 0.4 picocuries per liter. Um, and higher levels, higher levels, higher levels is more radiation. It gives you greater risk. The country has picked a number of 4 picocuries per liter as a reasonable number to say we should do something about. Low doses we do pretty well with, but the inflection point where it really starts to take off is probably around 2.7 picocuries per liter. And then more is obviously worse, but it's not an exposure just one time. It's an exposure long-lived over long periods of time. And how prevalent is it? So we pick a magic number of 4, which is, I think, a very reasonable, conservative, well thought out number. But studies in our own state of Utah, we found perhaps that a third of houses have numbers that are greater than 4. And I think there's a lot of variations there. No one, we say that changes include atmospheric pressure and whether your doors are open or whether your doors are closed. Time will change things. If there has been blasting in your region, then perhaps it will change the cracks underground. My own personal experience is my house didn't have radon. I was one of those who was very aware of this quite early and actually checked my house quite regularly. It didn't dawn on me, but I had skipped a year or two, and we had had an earthquake sometime in the middle, and thought maybe it would be a good idea to go ahead and check again. And to my surprise, even though I had checked several times before over the course of several years, we actually ended up with elevated radon levels in my house. Prevalent, but maybe a third of the houses in Utah. But most of the things we deal with in medicine, um, we're always talking about a small chance of making a difference. If you got a 1 in 3 chance of having a problem in your house today at this moment, it's something that you should do something about. And it's something one should think about more than once over the course of the lifetime of living in a house. Every Utah resident should know that radon exists. It is radioactivity. It's a cause of cancer. You can't see it, you can't smell it, you can't feel it, but it's there in every house to some degree. And and there are levels that are more dangerous than others. And if you don't test, you don't know whether you have a dangerous house or not. Most of the cancers we see at the cancer center are cancers you couldn't have done a whole lot about. But this is one that you really can do something about. And the chance to go ahead and take care of something that you could have fixed is just a chance that one shouldn't ever miss.